Hello everyone, welcome to Short's ultrasound cases. In this video, I'm going to show you what is VSD. Signs and symptoms. VSD, ventricular septal defect, is a hole between the right and left pumping chambers of the heart. The heart has 4 chambers, a right and left upper chamber, called an atrium, and a right and left lower chamber, called a ventricle. Normally there is no hole between the 2 ventricles, but some infants are born with these holes, called ventricular septal defects. Ventricular septal defects are among the most common congenital heart defects, occurring in 0.1 to 0.4% of all live births, and making up about 20% to 30% of congenital heart lesions. Ventricular septal defects are one of the most common reasons for infants to see a cardiologist. Ventricular septal defects occur in many locations and sizes. The ventricular septum is made up of different types of tissue, with one part composed of mainly muscle and another part made of thinner, fibrous tissue. The location and size of the hole within the septum will determine in part the cons. Signs and symptoms. Ventricular septal defects have a very characteristic murmur, to the point where a cardiologist may be able to pinpoint the location and estimate the size of a ventricular septal defect just by how it sounds. However, a murmur is often not heard at birth. It is only with time and pressure changes that flow across the hole between the pumping chambers can be heard as a murmur. A smaller hole may actually make a louder noise than a large hole, and the murmur may get louder as the ventricular septal defect closes. Think of a garden hose. If the water flows freely, it makes a soft sound. If you make the outlet of the hose smaller with your finger, the noise will get louder. It is important to remember a loud murmur does not necessarily mean a large hole. Babies who have significant congestive heart failure will have failure to thrive and will have difficulty maintaining a normal weight gain in the first few months of life. Babies with some extra flow to the lungs may grow well because their ability to feed remains unaffected. They may have some subtle signs of congestive heart failure, such as continuous fast breathing. If a baby grows well in the first few months, it is likely that the ventricular septal defect will not lead to congestive heart failure and the baby can be observed. If the baby does show significant signs of congestive heart failure, the ventricular septal defect may need to be surgically closed. Babies who do have moderate or large ventricular septal defects with excessive blood flow to the lungs will have signs of congestive heart failure. The most important sign will be the baby's growth. Thank you for watching. Please subscribe for more.